Jesus. Hello, everyone. My name is Damien Johnson, and this is.
And I am Briana Tovar.
Today, we will be giving you guys a presentation on diabetes. It will be a presentation on what diabetes is and also how to prevent it. We do have another partner that was working with us on the presentation, but as they could not join us cons- uh, to to explain the presentation, but they did help us with the work. And that was Isabel Gomez. So first we will discuss on what diabetes is. For those who do not know what diabetes is, or for those who do know what diabetes is, this is just a refresher, and it's just to help you with knowledge in case you have someone who has diabetes, or you may see that you have symptoms of any type of diabetes, either whether it be type 2 or type 1, or if you don't have diabetes but just wants to be prepared for the future in case it could happen. Okay, we will go on for the first slide. First slide.
Okay. What is diabetes? Diabetes is a group of diseases that result in too much sugar in the blood, which is the high blood glucose. There's type 1 diabetes, which is an autoimmune illness in which the immune system targets and kills the pancreatic cells that make insulin, a hormone that aids in blood sugar regulation. And there is type 2 diabetes, which is a metabolic illness brought on both brought on both inadequate production and insulin resistance, which is the body's ineffective utilization of insulin. Obesity, inactivity, and genetic predisposition are risk factors for type 2 diabetes.
Next slide. Next slide, we will be talking about the causes of diabetes. Now, these are not the only causes. There are many different causes of diabetes, but we will be focusing on these five. So the first one is overweight. Um, just because you are possibly overweight or seeing yourself as mildly obese does not mean that you have diabetes. It could be considered a different type of health problem, or it's not really a health problem at all. Some people are born with bigger bone and marrow, but we are really just talking about overweight, which can cause diabetes depending on your health topics and how you present, and just focus on your own body, which can lead to more health complications because of overweight and also being with diabetes. Not saying that people with diabetes are always overweight. Some people can be very slim and toned and still have diabetes. But a majority of the world who do have diabetes are seen on the overweight spectrum. Another one would be inactivity. So exercise is key to help your body flow and to just keep it above and beyond, so that you wouldn't have diabetes come towards you in the near future or the near present. Um, Having like exercise, not on a day-to-day basis. Sometimes we don't have time for exercise, but just having us move around the house or walking from work to school, things that helps us lower our chances of having diabetes altogether or different health complications without having any type of inactivity. But it is good to have activity, movements, and all throughout the day and throughout the week. Unhealthy diet. If you are the type of person to eat unhealthy items on a day-to-day basis throughout the whole entire week, you are most likely to get diabetes and also other complications. You can also get obesity if you are not skinny or underweight as well. You can get obesity or any types of other things. You can have your heart problems, heart arteries, but diabetes is one of the things when it comes to unhealthy food choices. So try to eat healthier food choices. Sometimes healthier food choices is not always what we want or what we can afford, but it is good to try to keep your body flowing with healthier options than options that are unhealthy. Genes and family history. Sometimes people who have diabetes cannot help the fact that they have diabetes. It runs in the family to the point where it's called genetics. If I'm not mistaken, diabetes can run in a lot of families, especially Black families, depending on their health risk and complications. So if you do have uh, genes and family history that you know people who do have diabetes, I would suggest reaching out to that family just to get a better clarification on exactly what it is that you may or may not need to worry about in the future. High blood pressure is also another thing. High blood pressure can happen for any type of reason. It can also be lead with stress. Diabetes really gives you high blood pressure. So you just have to mellow yourself down and just focus on certain things to make sure that your blood pressure does not go all the way up, because then it could lead to other things and other health complications besides with the diabetes. Okay, we will be moving on to the next slide.
Diabetes and different age groups.
Yes. So for the first one, we will all say this: diabetes does not care if you are a newborn or if you are 99 years old, making your last trip to the world and about to reach the heavens. Diabetes goes for everyone. It doesn't matter who you are, how you live, what you live, depending on your types of health situations. If you do one wrong thing, that doesn't mean you will get diabetes. If you continue doing wrong things, then you will have diabetes, most likely. uh, it is just me saying that if you are a child, you could still get it. If you are a young adult, you could still get it. A teenager, an older adult, it does not matter. You can still get diabetes because everyone is not immune to diabetes. No one is immune to diabetes. Children and adolescents. For most children and adolescents, the type of diabetes that they normally would get was type 1, which would be developing in their immune system and also can attack their bodies and destroy cells that basically just makes the insulin to prevent it from happening. But just for children in themselves, I would suggest to just make sure to watch the children, watch the child. They can have their sugar and sweets. Nobody's going to stop a kid from eating sugar and sweets unless they're cruel, because some parents out there are cruel who don't going to give their kids sugar or sweets. But it don't hurt nobody to have a little piece of candy now and then. But just watch to make sure that they don't overdo it with the sweets, and make sure that they still eat at least a bunch of fruits and vegetables, even if you have to blend it up in a smoothie and say it's strawberries. Okay, next one, Brianna.
Young and middle-aged adults. Type 2 diabetes is a more common in this age range. It is frequently connected with being overweight or obese, as well as leading a sedentary lifestyle. This age group is also at risk for gestational diabetes during pregnancy, which a mom can get diabetes during or after she gives birth.
And as for the last one, older adults, we are not coming for you. It's just that mostly when we hear about diabetes cases, it happens to most older adults. Even if the age group of the chart says it, most people hear about older adults getting diabetes over children or kids or possibly young adults. People 65 and up mostly are really more at risk to have diabetes than anyone else, even though it is most common in certain age range, but we normally hear about it with 65 and up on people. That it'll also lead to different other diseases. So saying if you have diabetes and then you have other health complications, it can be considered the worst risk to have at that certain age, because you can develop more increasing ways to strokes, retinal disease, eye difficulty, where it considers the lose eye vision, either partially or completely lose eye vision in older people. As for the chart that's saying, as you can see, even though that the percentage of each of them is different, it shows that nobody is safe from diabetes. So in all honesty, please be careful, please watch your health, and just be aware of how you give your body what it needs. Okay, next slide.
Diabetes and gender. Men are twice as larger to have type 2 diabetes than women. Men do tend to eat more unhealthy food than women. Women are more cleaner and careful with what they eat. Females have more greater risk of complications and death than men. Symptoms which are particularly observed in men are loss of muscle mass and genital thrush. Women often experience symptoms such as genital yeast infections, urinary tract infections, and polycystic ovary.
So even though it seems as though we're attacking you guys on the possible sex drives that you may or may not have, we are not. We are just reading information that we have researched. So yes, so for us men, if you do enjoy your physical activity and you are experiencing some affection, please seek out medical help. That also goes for the ladies. If you are seeing something that is not correct right down there, please seek out medical help, especially if the symptoms continue on for a week. It can lead to something even much more gross. Next slide. Now we will begin on the complications. And this is basically me attacking everybody, but in a good way, because it's just letting you know the complications you can have if you do get diabetes or if you have diabetes. So, heart and blood vessel disease. That is basically saying that the blood flow for your hearts and like your blood vessels could possibly decrease in flowing, and it can stop your blood from just reaching its point that it needs to be, which can also lead to some type of nerve damage. Chronic kidney disease. You like having kidneys? Okay, please work on your body. Everyone likes having kidneys. Um, you ever heard of complete kidney failure? Kidney failure can happen. It's just as bad as if you were an alcoholic. Diabetes can shut down your kidneys completely, just like alcohol. Nerve damage. You can get nerve damage from anywhere in your body. If you have diabetes and if you have nerve damage in your brain, then that is a very, very risky thing because your brain basically controls everything in your body. So saying if your brain did not get like the nerve information from your hand could go limp. You would have no type of connection or body to your hand, and it could just move slowly and literally just as out of place as possible. See, because it did not get the message for your nerves, for your arms and your hands to function correctly, or your feet. Now, I honestly say, if you have some nerve damage in your feet and you try to get up, sit back down because you can actually break your leg that way. If you feel as though you do not have any blood flow or any types of nerves completely trying to flow down to your feet or your legs, please sit back down because you can break your legs. Oral health. Now, everyone loves their teeth, if I'm not mistaken. Good. If for some reason you have uh, diabetes and it affects your oral health, you will see a bunch of built up bacteria growth. And let me tell you, that is the nastiest thing you can ever see in someone's mouth. Yeah, that is the nastiest thing you could ever see in someone's mouth. So if you do have bacterial growth, I would suggest trying as many different ways as you can to get rid of it or to see a doctor to ask them for medication or professional help. Do not try something on your own that can permanently damage your teeth to the point where you will have no more teeth and just gums. Vision loss, like I said in the other slide, you can most likely have partial vision loss or all vision loss, depending on the nerve systems in your brain. Because if those waves do not connect all the way, they can just shut off on you completely. Hearing loss, you can have partial hearing or no hearing at all. And it's not saying that it'll be both ears. Sometimes it could be one or the other, or it could be both. If that does happen, suggest to seek to a doctor to possibly get like a hearing device or a hearing implant in your ear so that you can be able to hear. Or if you want a new thing to learn, sign language. That is a very good way to communicate. Strokes are no fun in whatsoever. Strokes can like they can be as painful as getting a needle stuck in the wrong area. Um, Strokes can lead to you having uh, Bell's disease, Bell's,
Palsy.
huh? Say it again.
Bell's palsy.
Bell's palsy, which could lead to like partially your muscles in your face just showing like a droopier face or like sag. And most people that won't clear up, that will just stay with them for the rest of however long they have to live. Even if that happens, I suggest like don't take it to heart if you do lose like muscle problems because technically it happens. It doesn't happen to everybody who has a stroke, but that does not mean that you are not immune to having it. You could have it, but it's not also about just having strokes. You can lose your muscle control over any time. Next slide. Now we are at the preventions after we have lectured you all on the complications and what diabetes is and given you a little bit more helpful reasons and things. It is time to tell you how to prevent the diabetes,
The diabetes.
Briana.
Okay. Maintaining a healthy weight, being overweight or obese might make controlling blood sugar levels more difficult and raise the risk of health problems. By maintaining a healthy weight, can you exercise, get daily exercise, exercise about 3 times a week for an hour and a half. Drinking plenty of water, getting the right nutrients for your body, and try avoiding unhealthy foods. Managing stress. Stress can boost blood sugar levels and make diabetes management more challenging. Finding healthy stress management skills such as exercise or relaxation techniques. There are plenty of ways of managing your stress.
For
Um,
instance, yoga or reading a book, even listening to some type of music also helps.
mhm. Taking your dog for a walk, going yourself by yourself on a walk, and yeah. Maintaining a healthy diet, choose meals with minimal sugar and carbohydrate content, eating plenty of fiber, focusing on lean protein, limit saturated and trans fat. You can do um, fruits, vegetables, yogurts, healthy yogurts, as in probiotic yogurts, Greek yogurts. Yeah.
Or trying new options. Some people enjoy vegan style foods that help also to not give complications or prevention from diabetes. For instance, tofu. You can make tofu taste like anything if you cook it the right way.
Yes, and with good ingredients.
Yes, and with good ingredients. Tofu is actually a very good food. I would highly recommend it. Next slide. Now we will talk about preventative treatments and treatments for diabetes. So this slide is based on if you do not have diabetes and if you do, the prevention treatments to help it so that you don't get diabetes, and then the treatments if you do have diabetes. So for instance, on the top of the list, no smoking. Smoking leads to so many different health complications. It should be um, the number one thing in every type of health complication there is to say, don't do smoking because then it will lead to other things. It can lead to diabetes, it could lead to lung cancer, and it could lead to possible weight gain as well, actually. It could lead to smoker's lungs or bronchitis, stuff like that. In the olden days, there used to be an iron lung for people who couldn't breathe because they smoked too much. Um, I don't know if iron lungs are still around, but unless you don't want to be in an iron lung, please. I am not saying don't completely stop smoking because I know that stopping smoking is a process and it can take a while. You can try by decreasing the many times you do smoke a day or in a week, and then just slowly. There are also little patches that can help, and also just reaching out to somebody who can possibly help you with your smoking habits to stop it. Monitoring blood sugar daily. I would honestly say check your blood sugar at least 3 times a day, morning, afternoon, and night before you go to bed, because anything can happen. You must make sure that your blood sugar is at a normal rate and not at a higher or lower because things can happen during the day or during the night where you can have complications because you did not check your blood sugar, or maybe you didn't eat enough, or maybe you ate too much, and then you'd either end up in the hospital or in worser conditions. Regular A1C tests, measuring your blood sugar levels is basically the best thing you can do to make sure that they're very accurate and to make sure that you're on the right track. Getting those regularly done is very good for your health and making sure that your diabetes is in track. Or if you're not having diabetes, you can still get your blood tested just to make sure that you're not in the track to get diabetes. Annual foot and eye exams. As I said in the early slide, you can possibly lose vision or even get like cataracts between your eyes, which can lead to other high complications, which can also still lead to blindness in your eyes. Not saying complete blindness, it could be half partially blindness or complete blindness. Or as for your feet, like feet exams, there are many different things that can happen to your feet. For example, um, your feet can start turning a different color from what your skin tone is. And if that is happening, then that means you are possibly losing blood flow and oxygen towards your feet and also your legs because of diabetes. And if it continues to spread all the way up to your legs, it could possibly lead into no mobility, meaning you would not be able to walk. And that can also lead to the fact that you would have to get your legs amputated or your feet amputated or any limbs that you have necessary amputated so that you do not end up having diabetes spread more towards your body than it would possibly spread to your heart, which would lead to even more complications, and that can also lead to death. Insulin. If you are prescribed insulin, it does not matter if you are a type 1 or a type 2. If you are prescribed insulin, please take your insulin. Do not skip your insulin day. Anything can happen if you skip insulin. You could go into a really weird shaking mods because your blood sugar is super low. Um, and then you would have to be forcefully fed sugar or something like that. I can know because I had that happen to somebody in my family, and it was very scary for me to see at a young age. And it was just wrong because his sugar was so low, and also because he did not take his insulin. Um, so if you are given insulin, please take your insulin. Next slide. Foods to avoid. Now, look, we are not telling you that you always have to avoid these foods. We are also saying that you can still eat them, but just try to eat them a little bit less. We are not coming from your health styles. I mean, for me, I would love a pizza any time of the day. I mean, like, who don't love pizza? Like, yeah. So, okay, Brianna.
Okay, so we have bread, specifically white bread. It is not the healthiest. You can substitute it for whole wheat bread, multigrain bread. Um, there's pastries, sugar, certain pastas. There are pastas like whole wheat pasta. There's also a specific pasta made out of beans, which is also healthy for your body. High fructose corn syrup, which is in certain cereals, some sodas, and yeah, soda isn't really the healthiest for you. Artificial fruit juice, as in the powdered, um, what is it?
Powdered juice packet,
The powdered juice packets,
such as Kool-Aid.
Kool-Aid,
Looking at my black folks over here, such as Kool-Aid.
Kool-Aid, and you can substitute it for something more healthier. You can make your own fruit juices, as in like a lemon juice, orange juice, something more healthier than a packet full of sugar. Red meat. Red meat does have a lot of sodium in it, and yeah.
Next slide. Well, I bet you all are tired of hearing us literally coming for your throats, but it is all in good faith because we are concerned about everyone's health. Everyone should be concerned about their own health, even if they don't think that they are not the most unhealthiest. They could possibly be seen as the most unhealthiest or the most healthiest. But hey, it is your body. Without further saying that, in conclusion, that completes our basically topics, preventions and strategies pertaining to diabetes, type 1 and 2. Remember, everyone, to always look out for your health. It is up to you to keep your body healthy. It is not up to us to keep your body healthy. You do not have to listen to your doctor. You have to listen to your body because your body can become your enemy instead of your friend, because if you treat your body like an enemy, your body will treat you like an enemy.
And it's the only body you have.
It is the only body you have. Even if you still get like prosthetics for your arms and stuff, your body can still turn on you regardless.
Mhm.
I hope that this presentation helped you to understand the concepts, problems, and complications and strategies of diabetes and how serious this health problem can be. Now, throughout saying all of this, diabetes is still one of the worst things that can happen, but it is not the only worst thing that can happen because diabetes can also lead to other health complications, as we explained throughout the whole entire presentation. And then diabetes can also lead to death. Sometimes some people don't get to have the treatment, they just keep going on until they leave the world, and sometimes it's not helpful for them. We do ask you guys to please complete the survey down below. The link will be down in the description below. And hopefully you guys did like our presentation. We are still sorry that Izzy could not join us, but he did help us create a very good presentation and helped us to understand and also give us knowledge on what we were learning. And fingers crossed that we get an A. So please, without further ado, I would like to say goodbye to you all and good night. My name is Damien Johnson, and
Briana Tovar.
this concludes our presentation on diabetes. Have a nice night and good day.